So good evening, everyone. Welcome to tonight's webinar. I'm Julian Capelli, board member and chair of the Education and Awareness Committee here at Lupus, Ontario. Lupus Ontario is the largest provincial voluntary organization dedicated to improving the lives of people living with lupus. Our mission is to provide vital support, education, awareness, advocacy, and research through the funding efforts of our staff, volunteer community, to help those with lupus live longer, healthier, and better lives. I'd like to remind everyone that this session is being recorded and will be posted on our YouTube channel. We'll have time to answer questions at the end of the presentation, so feel free to submit them at any point using the Q&A function or chat box. So let's begin with tonight's webinar, Work It Out, Occupational Therapy for Lupus Warriors with Dr. Behdin Nowrouzi-Kia. We'll explore the impact of work on health, emphasizing the role of occupational therapy in supporting patients with SLE through multidisciplinary interventions in collaboration with patient partners. And it's now my honor to introduce Dr. Nowrouzi-Kia. Dr. Nowrouzi-Kia is an occupational therapist and assistant professor at the Department of Occupational Science and Occupational Therapy. He holds the inaugural Emily Geldsaler Grant Early Career Professorship in the Workplace Mental Health. He is also an affiliate scientist at the Crumble Research Institute, Toronto Western Hospital, University Health Network, and a collaborating scientist at the Center for Addiction and Mental Health. He was also the founder of the Infinity Health Consulting Group and OT Services North. Dr. Nowrouzi-Kia uses an occupational lens to systematically study occupations related to workability, work disability prevention, and return to work. This approach is designed to produce results that are directly applicable to identifying, assessing risks, and developing interventions for preventing, improving, and optimizing functioning in the workplace. His work is motivated by efforts in the field of work of disability prevention that extend beyond efforts to prevent or cure diseases from a purely physical perspective toward holistic approaches. The major tenets of his work use a biopsychosocial perspective to understand work disability and extend towards incorporating personal, occupational, and environmental considerations. And without further ado, I will turn over to you, Dr. Nowrouzi-Kia. Thank you.
Thank you very much, Julian, for the kind introduction, and I appreciate all of you that have taken time out of your day or evening to join us here today. It's with absolute pleasure to have the opportunity to speak to you a little bit more about what I think is a very natural and intuitive relationship between people with lived experience and occupational therapy, particularly when it comes to lupus. And you'll notice that as I go through my talk, I'll be very deliberate in the language that I use, in that I want to make sure that it's inclusive, it's respectful, and that it maintains the dignity of people that are living with this condition. So you'll notice that I'll refrain from trying to make it a biomedical talk, but rather one that espouses more of a biopsychosocial approach, one that I think is the best strategy that we have as partners to work with together, particularly when it comes to improving the quality of life of people living with lupus. And hopefully by the end of this talk, I'll give you an opportunity to understand how I think occupational therapy is severely underutilized when it comes to one of the health disciplines that can support people with lupus, particularly when it comes to understanding the relationship with work and lupus. So, without further ado, I have some slides that I'd like to share with you, and for the next approximately 35 minutes or so, I'll tell you, or at least try to tell you, a story of how I think that this partnership between people living with lupus and occupational therapy is a very intuitive and I think very natural one that deserves more recognition. And hopefully by the end of the talk, you'll have a greater appreciation for both the role of occupational therapy as part of the care that you potentially are receiving. Okay, let me just share my screen here. And hopefully what you're seeing now is the full screen of my title page. Is that
Looks good.
okay? Great. Thanks very much, Julian. So, and when it comes to this title, I was debating, coming with a much more of an academic or formal title, but I used the same title that I gave at the Lupus Congress meeting in Toronto about 6 months ago. And the reason why I use the word warrior is that I believe people living with this condition really are resilient. You are fighters. You are able to withstand significant challenges in your personal life, and particularly when it comes to work, being able to sustain, stay at work, or return to work really does allow you to have a mentality of a warrior, somebody that is constantly vigilant and advocating for their ability to be included in the workplace and to engage in work activities. And we'll talk about what work really means to us and why I think the relationship with occupational therapy is very intuitive and a natural one. So before I do that, I wanted to just tell you a little bit about myself. You may be wondering, and maybe you've had other speakers here talk to you about medical management, lifestyle aspects to it. But from a rehabilitation perspective, I am a professor at the University of Toronto. I get the great privilege to be part of the rehabilitation sciences through occupational research and engagement lab, or RESTORE for short. And part of our mandate is really, or our mission rather, is to identify and assess risk and develop occupation-based strategies. So really those that focus on abilities, functioning, engaging in activities to avoid deleterious health outcomes, such as, for example, experiencing work disability, being outside of the workforce, because we know that there are, as human beings, we're intuitively driven to engage in activities that are meaningful to us, that we need to do and we love to do. And that's what I'll be talking to you for the next little bit. So my team, I get the great privilege of working with many, many dedicated people that are from learners in our programs, from the undergraduate, graduate, and postdoctoral level, in addition to other researchers and scientists and clinician scientists that are also actively engaging in research in these topics as well. And rather than leaving, my contact information at the very end, and I'm happy to share my slides as well. So no need to worry about it, jotting anything down. But this is my contact information. If you're interested, you can scan the QR code. You can visit our website. You can visit the lab's website, my academic profile, to learn more about what we're doing. And, at the end of this talk, I'd love to have greater engagement with Lupus Ontario, and particularly with patient partners, as we have, and we already started that momentum many years ago, and we want to increase that capacity and increase it in the way that patient partners and people with lived experience can maximize their use of occupational therapy services to augment their health and well-being as they live with lupus. So there are three objectives that I have for my talk. One is that I'd like to recognize and emphasize the work as a social determinant of health, and really highlight the relationship between work and health. There is an intuitive, positive relationship to us to an extent, and we'll talk about that, between working and our health. So when we are engaged in activities that are what we consider work, there is, to a certain extent, benefits. Obviously, like anything else, too much or too little of it could lead to poorer health outcomes, and we'll talk about that. I'll talk to you a little bit about what occupational therapy is about. Many are unclear as to what this health profession does, so I'd love to talk to you a little bit about that, and our role in return to work and disability management when it comes to systemic lupus erythematosus. And then finally, I'd like to identify some strategies and solutions, some take-home messages that you can, put into your back pocket and go and talk to your other providers, or, go into your workplaces and say, this is what I have as resources. How do I get to, stay at work or go back to work if you're off work at the moment, using a biopsychosocial perspective. And I'll delve into that as well. So that's kind of what I'm hoping to get to, what I'll try to convey in the next little while with you. So I'll start off by just talking a little bit about work and health. And, we can think of work as really the use of physical or mental health strengths, knowledges, skills, and other resources. And it really, work encompasses a lot of what we do, particularly when it comes to paid work, employment, and like anything else, work is related to our health. So if we engage in activities, there is a beneficial and natural gain that we get from it. And there's research to substantiate that. This figure is from a seminal text that's about 20 years old now, that looks at the benefits of work and its relation to health and our well-being. And too much of work could potentially have poor outcomes, for example, leading to physical exhaustion. Maybe you've heard of burnout. Too little work will mean that you're under utilizing your abilities, and that naturally means that it's hurting your well-being and your ability to engage and to provide meaning to what you do. And work for a lot of people has many different purposes. For some, there's a financial component to work. You work because you want to be able to pay your bills. For others, there's a personal sense of fulfillment. It's my ability to say that I have these particular skill sets and this is part of who I am. It's part of our identity. One of the first questions we ask somebody when we meet them is, "What do you do?" So naturally for us as human beings, this is an intimate part of who we are. And if that is extrapolated or taken out of the context of our contributions, this could have deleterious health outcomes as well. And as I mentioned at the very beginning, work is categorized as a social determinant of health. So it has intimate relationship to our health and well-being. And as a result of that, occupational therapy demonstrates that work can be therapeutic. Engaging in work activities can be good for us because it gives us an ability to improve our quality of life and well-being. So, and I've already talked about this, but I just wanted to kind of put this for you on the slide and realistically looking at the benefits that come with work, but at the same time that there are some risks, and you can kind of delve into some of those aspects from both the benefits perspective and also the risks as well. So, what is occupational therapy? Occupational therapy is a regulated health profession. An occupational therapist will go to university in Canada. You are required to have a graduate degree, a master's degree in occupational therapy. Then you have to write a licensing exam, and then you are eligible to work as an occupational therapist in Ontario, for example. And part of that is that occupational therapists often work with people of across the lifespan. For example, in the adult population, you'll be working with those that may have different levels of impairment or disability, and are able to assess their ability to do activities that are important to them or that they have to do. And some of those activities could be deemed, self-care activities, things that many of us take for granted. For example, being able to dress ourselves, go to the washroom, take a shower, go to work. And we'll talk more about that particular activity in a moment. And also other types of activities that are very meaningful and dear to us. For example, spending time with our loved one, taking care of our kids or our grandkids, engaging in activities in leisure activities that are important to us as well. So occupational therapists, um, work with individuals to engage and allow them to fulfill their maximum potential and ability to engage in the activities that they want to and need to and love to do. And oftentimes, when we do work with that, there's lots of ways that occupational therapists can engage. So, at the individual level, that's a very common way. An occupational therapist could, for example, see you in the hospital and assess your ability to take care of your self-care activities. In the community, an occupational therapist could come in to your home and provide recommendations about safety equipment that you may need, or they may assess equipment needs that you need, like a wheelchair or so forth. In different contexts with children, they may be able to provide services including assessment and treatment for neurodivergent children. In the context that I work with people that are either engaged in work activities and want to stay at work, or they're off work and they're going back to work. And as an occupational therapist, my role here is to engage with the client, talk to you about what is it that you're trying to do, particularly in the work context, and then as part of a multidisciplinary team, provide recommendations to support your return to work or stay at work as examples. And part of how we do that as occupational therapists is to kind of use different tools. And one of the tools that's very important for us is to kind of look at this concept that I mentioned a little bit earlier about the biopsychosocial framework. Maybe some of you, this is old news and you know it very well. Others may be much more comfortable with what you might see through our healthcare system to an extent, or maybe in popular culture, if you watch TVs or movies, called the biomedical model. So essentially, one that espouses that if there is a condition, an illness, or an injury, that there's a cure or there's a way to live with to be disease free or injury free. But in reality, many of the conditions that we see in our society are not going to be curative in their form. So as a result, rather than looking at it through a purely biomedical perspective, we want to look at it through a much more holistic and one we would label a biopsychosocial perspective. And part of the frameworks that we use as occupational therapists employ many of those attributes to look at it through a biopsychosocial lens. So, for example, the person environment occupation model is a very intuitive one that I find many people can grasp relatively quickly. And it looks at three components: the person, so what are the strengths, abilities of that individual? What about their environment? So you can think of the environment as not only just the built environment, but also the social environment. What is the organizational culture like of the workplace that you're going back into? Do you have supported coworkers? Is human resources and your manager and supervisor there to support you? Or is there a different atmosphere than one that you would think would be intuitive to welcoming someone who's off work, particularly with an episodic condition, to go back to work? In addition to that, we'd also talk about this idea called occupation. So in occupational therapy, this is a word that oftentimes for us as occupational therapists, it means, engaging in activity. But in the context that we're using it, we're obviously looking at activities such as paid work. So we look at the confluence or where the person, their environment, and their activity or occupation meet. And as a result of that, that relationship where they overlap is what we deem occupational performance and participation. In lay language, that means optimizing your ability to function at the highest level possible independently as possible. So when it comes to understanding workplaces and the return to the work process, this is exactly the type of model that I find people can grasp very easily, because you're looking at these attributes. So you're looking at the person, what's their environment like, and what are they trying to do? And if we can kind of look at the confluence where these three spheres overlap, or these three circles, that's kind of where we want to intervene, because that's exactly where we're going to maximize their ability to engage in meaningful activities, particularly when it comes to work in this case. So, what is occupational therapy as part of a multidisciplinary team? So, maybe the care providers that you have are mainly physicians, or maybe primary care providers. Maybe they're specialists like rheumatologists, or primary care providers like family doctors. But I think the benefit of some of the research that we're doing demonstrates that there's a need for multidisciplinary care. Every health profession will have their area of expertise. Some of that expertise is going to be resonated with your specialist and rheumatologist taking care of the medical management, making sure that you're medically, for example, stable, hospitalizations don't occur. Your primary care provider can make referrals to other types of care that you may need as you progress with your journey. But as a result of that, there's also expertise that's needed when it comes to understanding how you want to engage in work activities. And part of that is where occupational therapy could be working with other disciplines to assess someone's functioning. So if you're experiencing challenges at work, this is something that the occupational therapist potentially on the team, if you have one, or a referral can be made to occupational therapy in the community by your care providers, can be one where we could sit down with you, talk to you about what is it, the activities you're trying to engage with, understand and unpack that from not only a very medical or healthcare perspective, but we can also engage with workplace actors and parties, including but not limited to unions, allies, other vested individuals that are part of this return to work journey. And really, as part of a multidisciplinary team, what we do is complement each other's areas of expertise. So while there might be an area that I'm not very familiar with, someone on the other on the team will be. And as part of the health team, we oftentimes have this ability to engage with other partners. And occupational therapists, we're very comfortable and understand that, when it comes to work, the health component is one attribute of it, but there's also other types of considerations to have as well. So I won't belabor more on this too much, just to say that one of the areas that occupational therapy has expertise in assessing and providing treatment is looking at function and activities of daily living, basic activities of daily living, instrumental activities of daily living are all part of the considerations that we as occupational therapists have when we work with our clients. So, things like feeding, yeah, dressing, taking showers, driving a car, doing your finances, shopping, going to work, all the things that many of us take for granted are exactly where occupational therapists can be part of your care team to provide those services. So now let's dig a little bit deeper and talk about return to work and what return to work means for particularly in the context of lupus. So return to work can be a process that essentially supports somebody going off work and coming back, staying at work after and maintaining their employment. And if they are off work, how do we get someone back into the work environment? Return to work is complicated. It oftentimes resides with far more than just having the ability to consider the health or medical aspects of the care. It requires us to have considerations for the social aspects. And in many times, from my experience working in this area, both clinically and in terms of the research, it requires us to go into a conversation that involves much more in-depth discussions with the employer and to understand what is it that the employer's role is in this in return to work and where the healthcare provider's role is. And we'll unpack that a little bit as we go further along. So, some of the questions that people going to work, regardless of the types of condition you may have or the presentation that you may have, for example, in our case, we're talking about lupus, but it doesn't really matter. We come up with very similar questions, and these are very appropriate questions for any of us to have. Am I ready to go back? What if I'm not successful? What if I need more time? How will I be treated? Is there someone to support me and help me out if, I have questions or there are moments for me to pause and reflect further? I think in all of these scenarios, the answer is that yes, there is, supports for you. And how do we provide that support? That's where occupational therapy can come into this. So as care providers, we can work with the health team and come up with a very detailed plan as to how we can support the medical aspect and the healthcare aspect. So, for example, maybe there are certain considerations that you may have in the job that you do. So, maybe there are some restrictions or things that you shouldn't be doing. Maybe you shouldn't be lifting a certain amount of weight. That's on the medical side to make that determination. Maybe there are also some limitations of things you potentially couldn't do. But if we put that all together, we can take that health and medical aspect of it and come to the employer and sit down with them and say, you know what, this particular person wants to go back to work, but there are certain aspects of they're not able to do certain things, and we advise them that they shouldn't do other things. So, for example, maybe you shouldn't lift more than 15 pounds, or that you should take a break every 10 minutes, or that you shouldn't be seated for more than 5 minutes, or you may need a quiet room, or that the break should be provided every 15 minutes. And then we have this discussion together, and your occupational therapist is the type of person that can do this, is to sit down with the employer and understand the employer's perspective. Because as the healthcare providers, we can come up with recommendations about what accommodations could be provided in the workplace, but ultimately it is up to the employer in Ontario for them to provide that type of accommodation. And that's where a discussion can be had. And in addition to that, many times, many of your other healthcare providers, including your primary care providers and specialists, may not have the same appreciation or the time or the training to understand what the actual workplace is like. So we, as occupational therapists, we can evaluate your function in the actual work setting. There are certain types of assessments that can be done so we can understand where exactly your functional capacity is at, and then come up with a determination and present that to the employer and have discussions so that the return to work process is a successful one. And what does that success look like? From the researcher side, if I can put my researcher hat back on for a moment, the epidemiological data from the last 30 years demonstrates, and this is research that's come out largely from physical ailments, and I'll talk about that in a moment, that looks at the probability of going back to work over time. So early intervention, regardless of what the type of a condition is generally associated with better return to work outcomes. I'll allow you to reflect on that for a moment. So this data is largely acquired from people that have had back injuries or low back pain, which is a very common a type of presentation that we see when return to work. We, to the best of our knowledge to this day, this data shows that for these types of conditions, this is the pattern that we see. Of course, we don't have the empirical evidence to demonstrate what it would look like for lupus or other episodic conditions or mental health conditions. But the overall trend generally stipulates that the earlier the intervention can occur, the earlier you can provide referrals to other health providers, to including OTs or other rehab professionals and vocational professionals to be able to intervene and understand this return to work journey, the more likely you are. And as you notice, by the time you get to 6 months, 9 months, and 12 months down the road, the probability drops to a third of going back to work and being successful. And unfortunately, if it goes much longer than that, the likelihood is less. It doesn't mean it's not possible, but it just means that from an epidemiological and a research perspective, the likelihood decreases. So, what are some of the ways now that we can strategize and work together to ensure that, there are ways that we can address some of these challenges? So, I talked a little bit at the beginning about coming up with solutions and strategies, things that you can take and apply them to your life in terms of return to work considerations and work. So, about 8 years ago now, 9 years ago, a former OT student of mine, we wrote this position paper in the American Journal of Occupational Therapy where we argued that many healthcare providers, including occupational therapists, oftentimes were situated when after the injury or the illness or whatever the condition was, and we were very comfortable working in this reactionary manner. So after somebody was ill, after somebody was injured, particularly when the return to work context, and then we brought we had all these strategies about disability management models, providing a holistic level of care, and returning to work in that capacity. But what we challenged our colleagues to think about, and others, of course, is that we should be reacting before things get worse. So that pre-injury, the prevention model. So that type of thinking is exactly where a lot of my research is headed, and also a lot of my efforts in understanding the return to work process, particularly when it comes to episodic conditions as well. So, what are some of the other strategies that may be helpful to you or that you can potentially apply into the work context? I think the Canadian Standards Association, or the CSA group now, has also developed many resources, and these are what they call standards, or essentially, if I can use lay language, guidelines that provide information to help organizations, workers, unions, and their allies to kind of situate what it looks like to work and how can they best implement, for example, from a holistic perspective, keeping people in the workplace. So there's a specific standard that came out in 2013, and it's the CSA 1003, the Psychological Health and Safety in the Workplace. And that standard looked at mental health considerations in the workplace, and it gave very specific guidelines. And it emphasized not only the role of the workplace, but healthcare providers and also people living with people with lived experience of mental health conditions. And that standard, it gets renewed every 5 years or so. So it was renewed in 2018, and then just recently in 2023, and it came out in 2024. In 2020, the Work Disability Management Standard came out, and this was also another set of resources and tools to support people stay at work. And it really demonstrates that the relationship for keeping people at work, coming back to work, was a shared responsibility, one that emphasized that not only are people with the condition or people with lived experience have a role to play in their return to work journey, but so does the employer. And coming together, this particular standard provides very concrete and specific outlines as to how to effectively manage workers' health needs and how do you keep them at work and minimize work disability, which is particularly important when it comes to lupus, because oftentimes there's a waxing and waning, good days, bad days, and how do you do that within the context of the workplace? It also emphasized again the role of healthcare providers in this role in this discussion, but it emphasized also that there's a role for the workplace and the employers to play as well. So everybody has to be on the same team, and everybody's journey is going to be different. So maybe you've heard of the term like functional medicine or functional care or individualized medicine or individualized care. This very much plays to that. Everybody's journey is going to be different. Everybody's story is going to be different. And as a result of that, customized, tailored approaches that look at the individual and how they can be best supported to stay at work or return to work are at the heart of this standard as well. And the CSA 1003 standard, just so you know, is available free for download. It's a voluntary standard that workplaces can implement. The CSA 1011 standard is also a voluntary standard, but unfortunately, it's not free. It's about $120 plus tax to download the standard. But again, it's used to implement across different workplaces and also across different settings as well. So I just want to talk a little bit more about now. I've ta about some of the research that we've done, and to kind of delve into what some of our findings is and some of the research that others have done, particularly around lupus and work and return to work context. So a few years ago, a colleague of mine, Dr. Zahi Tuma at the Toronto Lupus Clinic, University Health Network, and I received a grant from the Canadian Rheumatology Association, and we were looking at the impacts of work disability in lupus. And we studied people with lupus across various centers in Canada, and we collected data from the people with lived experience. We also collected data from their rheumatologists, and we also sat down with them to do one-on-one in-depth interviews to discuss what their return to work journey was like. So what was it like for somebody who has lupus to go back to work? Or if they hadn't gone off work, what was that experience like for them to stay at work? So we kind of unpacked a lot of these types of stories and challenges that people had. And one of the papers that we've published is looking at demonstrating the emphasis on function, workability, work disability from the perspective of people with lupus. And we used the qualitative approach. And what did we find? So essentially, what we found was that there were three key influences that people highlighted in our research. One was that the patient perspective is critical, and that the influence of the illness on the work experience was one that we had to highlight. So we really emphasized the fact that the illness has a significant impact on people's ability to engage in work and stay at work. And most participants in our study experienced some sort of work disability across their employment history related to their clinical manifestations of SLE, including hospitalization, physical limitations, engaging in activities of daily living, fatigue, and neurocognitive symptoms, for example, like brain fog. So that's quite significant that many of them highlighted this. They also talked about the idea of stigmatization of the illness. So, disclosure. So if they went to their employer and said that, I have lupus, they were very fearful that they would be labeled and that they would be potentially marginalized or excluded from the workplace, or that in worst case scenarios, they would no longer have employment to look forward to. In addition to that, they recognized and discussed the fact that there were limited discussions and availability of workplace accommodations and resources. So in Ontario, the Human Rights Code emphasizes that workplaces have to provide accommodations to the point of undue hardship, or the idea that, as long as the business doesn't impact, gets impacted financially in a way that it would significantly alter its operations, they are legally obligated to provide accommodations. But our participants were emphasizing that they didn't get appropriate accommodations when it came to um, staying at work or going back to work as a result of their condition, and also many of them exhibited and demonstrated to us that they had significant functional challenges, and those functional challenges restricted them from engaging in work activities. So much so that in some of the other work that we're writing about now, their level of functional impairment and disability was comparable to that of patients that were living with a cancer diagnosis. So a significant level of impairment. And just to give you some hot off the presses analysis that we're doing right now, we found that in general, many of the patients with lupus in our study had work disability rates that were probably in the 93rd, 94th percentile, meaning that on some of the evaluations of function, they scored essentially only 5% of the population scored higher than them. So demonstrating severe levels of impairment, which requires a significant intervention and approaches for us as care providers, and particularly as occupational therapists, to support people with this level of impairment to be able to engage in the activities that are important to them or that are necessary for them to do. Some of the other work that's been presented from others in this group is looking at the importance of occupational therapy with people with adults, and there's research from this particular systematic review that found self-management and educational interventions to be appropriate, physical activity interventions to be relevant. They also found that all of these are important. So these are just very high level from some of the other studies as well. Other studies also looked at young adults with episodic disabilities facing unprecedented or unpredictable disruptions to their employment and health. No surprise to us as well. Um, and I want to conclude by perhaps giving you a message, one, to show that I'm available and open to partnerships with people with lived experience, particularly when it comes to lupus. In order for us to do this work, we have to work as part of teams. When we write our grants for funding and research, oftentimes now it's a requirement. It is a requirement to have people with lived experience as part of our grants, and we have them as part of our grants. So if you're interested in contributing to the research, engaging with us, and I'm sure the participant group here is very much engaged because you're attending sessions like this and you're contributing to research in many different ways. I'm happy to collaborate with you to extend the research in lupus well beyond looking at it from a biomedical perspective, from a medical, sorry, a drug management perspective exclusively, to one of empowerment, of engagement, and fulfillment in activities that are meaningful to people. And the way to do that is for us to work together to generate and build capacity in this area so that we can go to funders and demonstrate the need for these types of health services for different populations, particularly in the lupus. I think there's a significant level of underutilization of rehabilitation services, particularly occupational therapy, when the evidence is clearly beneficial, yet we're not seeing very much of it. I think in the research that we did and we continue to do with our partners at Toronto Lupus Clinic and across Canada, the use of occupational therapy services is severely underutilized. So let's work together to identify questions that are meaningful to you. Let's work together to design studies and conduct them together, and also to communicate these findings to the various stakeholders that need to get these messages across. And then finally, I'll just wrap up by saying the following. Employment is a significant social determinant of health, and it's intimately tied to our health and well-being for all of us. It has an impact both positively and negatively on our physical and mental health. Occupational therapy can be a significant source of empowerment and engagement for people with lupus to be able to engage in work activities and to stay at work and mitigate against work disability. And ideally, we want to come up with effective workplace accommodations that consider the entire attributes of the individual, right? Their entire story, their full potential and full ability. And I think one that emphasizes abilities and function rather than just symptoms. Because then we know many people, and a lot of the research has focused on symptom aspects, but rather than abilities. And when it comes to return to work, the research is clear. You've got to focus on people's ability or what they're able to do. And that's it. So I'll stop there, and hopefully that leaves us a little bit of time to have some questions and some discussion.
Thank you so much, Dr. Nowrouzi-Kia. That was a really wonderful presentation. I was really blown away to see that chart, to see that you're more likely to be out of work the longer you stay out of
Yeah.
work. That was really interesting to see. Um, yeah.
Hmm.
But yeah, please, those in the audience, feel free to ask any questions.
Absolutely.
One comment was someone who has lupus and who's going through the politics that are involved with having been off recently, so they're interested in sharing their story.
Sure. Yeah, please. Happy to connect with you. My contact information is in the slide deck that I'll happily share. Thanks for reaching out.
I guess one question I had is what advice would you give those given the challenges when talking to your manager
Yeah,
and disclosing the lupus, what advice would you have in regards to burnout? Um, uh, those experiencing burnout when things are starting to become too much at work, and then let's say you're
sure.
experiencing a flare, how would you approach
Yeah.
that?
Yeah, I think that's a great question. Like anything, like any other discussion, depending on the relationship that you have with your workplace, that's probably going to take you the furthest along this journey. So, I think if you've had the ability to disclose your condition, I think they'll hopefully have a greater appreciation and provide you with the accommodations that you would need. So, for example, maybe that accommodation could be having additional breaks. Maybe that accommodation is that you have a more of a hybrid arrangement if you're working in person. It varies. There's lots of ways that it can be done, but I think what would be key is that, you have frequent and timely communication with your employer. There's a series of return to work principles that have been created by the Institute for Work and Health, and they kind of emphasize a lot of these types of discussions around that. So I would say engage with your workplace, have these discussions, and if you need to, then I would, also get some support from your health team. And they can also provide some more support as to why, for example, these types of accommodations could be important for you if that's what you need, for example, to mitigate against burnout. In many cases, burnout is a syndrome, not necessarily a medical diagnosis that looks at a constellation of aspects like cynicism, lack of negativity towards work, and it's a bit insidious in the sense that you don't realize how deep you are down this path of experiencing burnout until it's very further along. You don't realize it. So I think if you can avoid things or catch them early, that's probably the best way, like anything else in life.
Yeah, thank you.
Yeah, yeah, no,
Transparency is
my
very
pleasure.
important. I have a few questions coming in now. So, first being, can you ask for accommodations from your workplace without having to reveal your diagnosis of lupus? If so,
Yes.
can it be more vague so there's so there's personal protection?
Yeah, absolutely. I mean, this discussion about disclosure is a significant one, and there's quite a bit of research to talk about what that disclosure looks like. So, for example, particularly for mental health conditions or invisible disabilities, including those that are episodic in their nature. So you don't have to disclose the diagnosis. So, what could be done from your health provider side is that you can have this discussion with your care team, and they can provide a series of considerations or accommodations that they believe would be appropriate for you without giving, a diagnosis to your employer. And then the employer is or their role is to look at those accommodations, see what they can provide and what that looks like. Obviously, the from a patient privacy perspective, the employer is not in your circle of care, so they're not within that health team that can share the health and medical information as part of the team. So they're not necessarily going to be privy to that. As a result of that, they can be presented with just what they need to do to provide the accommodation. So yes, the short answer is yes. I think in practicality, what you should also consider is that oftentimes from the employer's perspective, people are meaningful. They want to support their workers because in many cases, the workers are the best assets that an organization has. But for them to understand why they're being asked to do this is probably very important too. Like they may not have a full appreciation of what lupus is, or if they do, to understand it in the context of work. So having an opportunity to provide that bit of knowledge and to be able to answer questions and have somebody on the team like an OT who can, sit in those discussions with them and to relay that back to you and also have further discussions by talking to your primary care provider, the specialist on the health side, because that can bridge a lot of gaps that oftentimes the breakdown in communication may lead to people not understanding and then it becomes more adversarial than it needs to be.
Yeah, great answer. And that was a great question.
Yeah, it's a great question.
And another comment, this is a very informative session. I'm glad it was. The comment about needing to focus on abilities versus symptoms was really impactful. So that's
Yeah,
good.
absolutely. Yeah, I'll just add to that I think that's where, when it comes to return to work, that's where the state of the literature is too. Oftentimes we have this concept called fitness for work or fitness to work. And in it, we emphasize that when it comes to evaluating someone's ability to do a job, rather than looking at what the symptoms are, evaluate what they're able to do. So, and there are lots of ways that we can do that. So there's resource tools such as a job demands analysis where somebody will come into a workplace and observe what they're doing and then come up with a very detailed evaluation of what their psychological, physical, sensory demands are, and then fit that to the type of work that's available. There's also other types of standardized tools like functional abilities evaluations or capacity evaluations where you can measure very quantitatively someone's physical ability. So the emphasis should be more on function and ability and less on symptoms.
Wonderful, wonderful answer. And another comment, unfortunately, some organizations will put you on a step or improvement plan program if you don't provide that you have an autoimmune disease. Yeah, so
Yeah.
that's unfortunate.
I
Yeah.
think I think that's part of the education piece that comes into it, and being able to advocate and having allies goes a long way in that regard because I think really them understanding what the needs are and why those accommodations are required is really the only strategy that you have. Oftentimes, yes, if they go into this situation where they want to streamline you or put you in a specific channel, I think what you can perhaps counter with is that everybody is different. Everybody's abilities are going to be different. Everybody's return to work journey is going to be different, and that if you put someone into the same path, it's not going to work necessarily that way. And you really have to have some more deeper discussions. And that's, I'm giving this to you in obviously a very idealistic manner, but in the real world, there's give and take, and sometimes, some workplaces, like anything else, may not be as forthcoming or as supportive as others.
Right. And oh, and then another comment was Kathy is a patient of Toronto Western Lupus Clinic and is interested in participating in ongoing research on this
Sure.
topic. So
Yeah.
it's great.
Yeah. Happy to reach out to us. Happy to talk to you.
And another question in the chat are what are some what not to do's?
In terms of, do they have more to that? What not to do in
Um,
terms of just,
Let's see if they send a follow-up.
Okay.
Oh, just in terms of the workplace.
Oh, I think, from my aspect, things that you can consider, I'll talk about the things you should potentially do. One is that encourage your health team and your workplace to communicate. Have somebody who is dedicated to the return to work journey from the
Hmm.
employer side. And ideally, if you have someone on the healthcare team that has that expertise, that would be very meaningful. Have timely care, have communication that is inclusive, and also that information is passed around in a meaningful way. If there are challenges or hiccups, try to address them as soon as possible. This is where a lot of the breakdown occurs. I was just dealing with a situation earlier today in another jurisdiction where the employer was for a different type of presentation, where the employer said we didn't hear anything from the workers' compensation for months. All we heard was there was an update and the person was still off work. And then they came to us one day and said, we need these types of accommodation. When these, if you just think of it from a human behavior or human being perspective, being left out of the loop raises a lot more questions. It decreases the level of engagement on both sides. So encourage engagement, encourage discussion, ask questions, and see if that's going to help with the things that you should be doing. Because it's very easy to do things you don't want to do, which is, not to communicate, stay in a silo, don't understand the other person's perspective, and focus more on symptoms rather than function.
Great. And are you able to share the contact details such as email for contributing to this research?
Yeah, sure. I'll just put it in the chat.
Great.
Hey, you can just contact. Yeah.
And one thing I do in my for my own research is look at like health technology assessment. I was kind of looking to see the indirect costs like from a societal perspective. Like is that something like you're capturing like in research or something you're looking at like the indirect costs like like patients face like from not being in work?
Yeah, no, that's an excellent question. It's not something we're doing because, to be honest, we just don't have that expertise. We need the health economists on the team to help us with the indirect and direct costs, but it's enormous, and I would say that it's probably something that would blow people's minds if we found out what it was. Like in terms of like mental health leaves alone, it's $50 billion according to research that was done in 2011. So you
Wow.
look at something like lupus that has both physical, cognitives, as my colleague Dr. Zaid Tuma says, the disease of a thousand faces, all the ways that it presents itself, it's going to be enormous in the way that it impacts our health and well-being. So I think I'd love to talk to anybody who's interested in that area, and if they're willing to provide that level of expertise, I think it's something we should definitely capture because I think it's probably very huge, the direct and indirect costs.
Wonderful. That's great to hear. Oh, and then and another, sorry if you hear a siren in the background, but another individual is asking, yes, about the research, can we participate? And is it like telling our story?
Yeah, I mean, from the qualitative side, it's like telling your story. It's we want to talk to you and talk about your return to work journey, and specifically, we ask questions related to employment. Were you off work? If you weren't off work, um, what were some of the aspects that kept you at work? What was your relationship like with your workplace? Those types of questions.
Hmm.
Yeah.
Great. All right. And if there's not any other final questions, I just want to thank you again for joining us.
My pleasure.
Really wonderful. I think it's safe to say that that concludes our session for tonight. As I mentioned, a huge thank you to our speaker, Dr. Behdin Nowrouzi-Kia, for his insightful presentation. To stay connected, please visit our website at lupusontario.org and follow us on YouTube, Facebook, LinkedIn, Spotify, and Instagram for more educational resources, upcoming events, and such as these and support groups. Yeah, so thank you again for everyone who joined us tonight, and I wish you all a wonderful evening. Thank you. Take care.
Thank you. Bye bye.